Can you heal bone-on-bone knees without surgery? What does the science say? Research shows that you can decrease joint replacement need with exercise alone. But what kind of exercise is best? In general, strength, flexibility, and aerobic exercise in combination has been the most effective. But the physics of bone-on-bone needs to be understood if we're going to determine a long-term solution. Quite simply, bone-on-bone refers to the joint space narrowing and subsequent rubbing of the joint surfaces in the knee. This happens due to a degradation of tissues from old age, sometimes leading to a bowing out of the knees, placing more pressure to the inside. In actuality, everyone experiences some sort of narrowing with time, so truthfully this is normal. The question of whether or not it has to lead to pain is another story. There's research showing that you can actually be asymptomatic with bone-on-bone knees, having no pain whatsoever. If you have bone-on-bone knees, your long-term prediction of disability is not determined by x-ray imaging, but rather muscle weakness. So consider this the next time someone rushes to get you put under the knife. So what can we do? Well, taking clues from the literature, one study showed that those who opted for a knee replacement had significantly less VMO muscle fibers. A 6-year cohort study showed that increasing knee muscle strength can actually prevent bone-on-bone dysfunction. Exercise can stimulate growth factors to repair knee cartilage. Quite simply, from a strength standpoint, we need to approach the weak link head on. With bone-on-bone knees, the joint adaptively stiffens to compensate for a lifetime of instability. So we want to progressively stretch that area, but we still need to account for the instability. You won't wear out your joints with exercise, but you will decrease concentration of catabolic molecules that, if not flushed out, will actually eat away at the cartilage of the joint. Use it or lose it as a biological context here. But you can even augment these effects depending on the loading. Data on the mobilization with movement concept show that even 2 weeks of consistent implementation of this motion can yield 24% more improvement in pain and function than just exercise alone, corresponding to a change from poor knee quality to good knee quality when re-examined over the span of 3 months, which is consistent with other research on this movement. Why such an increase in benefit with only 2 weeks? Deactivation of pain receptors in the knee joint, increasing joint lubrication through synovial fluid stimulation, and an increase in patient belief that their knees weren't ticking time bombs. Yes, you can do more than you might think, even with bone-on-bone knees. The body is fearfully and wonderfully made. And after rehab, what we do through ATG is just progressively overload this motion, increasing VMO and overall quadricep hypertrophy, further protecting against bone-on-bone dysfunction, further stimulating cartilage growth factors, more deactivation of pain receptors, more lubrication from the synovial fluid, and more hope that you aren't imprisoned by your knees. I have a few long-form videos on the ACL, meniscus, and cartilage of the knee that go more into depth of these biological benefits. Comment knee and I'll send them your way. Here's your greater pursuit of truth.